See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist, Shauna Butler.
I'm Shauna Butler, host of See You Now. Welcome to our new feature, The Moment of Awareness. Stories of problem finders and solution seekers, of inventors, hackers, wave makers, path breakers, innovators, and entrepreneurs. Stories that capture the moments of concern, empathy, outrage, distress, frustration, wonder, triumph, and the journey of problem solving, invention, trial and error, of convincing, conviction, and creativity. Let's get started. Children dying from vehicular heat stroke has increased in recent years. Since 1998, nearly 900 children have died because they were forgotten or became trapped in a hot car. The majority of hot car deaths happen because someone forgets and tragically leaves a child in a car. You may be asking yourself, how does this happen? Families who lost a child thought the same thing at one point, but then the tragedy happened to them. Shaken by the experience of treating a child suffering heat exhaustion after accidentally being left in a hot car, emergency room nurse Maria Striemer channeled her concern, her distress, and her insights into inventing the Backseet Buddy, a technology-based solution that provides parents with another approach and additional support in preventing this tragedy from happening to their family. In this moment of awareness, Nurse Maria Striemer shares the one experience that wouldn't let go of her, the moment that launched her invention journey by starting with a science-based understanding of how caregivers forget and leave a child in a car. Maria started down this invention path years ago, and along the way has been able to create solutions to other safety needs.
I was working in the emergency room one day when a dad came running in with his son. The child was lethargic, diaphoretic, suffering from pediatric heat stroke. We immediately started working on him, but it was obvious the deficits that he was already experiencing. Usually dad wasn't caring for him on the weekend and he went into the store and forgot that his son had gone with him that day. He had him in the back seat, got in the store, and by the time that he realized it was late, luckily he did survive, but not without those deficits. When you are a nurse, I think in any capacity, especially working in the emergency room, people think, well, you can go home and you don't have to do any more work or you leave it at work, but that's not the case at all. And this was something that I just continued to think about and just really, really weighed heavily on me. My husband's an engineer, and I said, we need to do something to prevent this. That's where Backseat Buddy came from.
It is a silicone house device that fits on the car seat. And when the child's placed on the car seat, it closes a signal and it sends a message to the phone and it reminds you that the child is traveling with you. And then once you leave the vehicle, if you have not taken the child off of the car seat, it starts sending text messages to your phone every minute. So you're going to get that alert.
We were injection molding literally in our basement, buying kits and printing molds and then injection molding those in the basement, then soldering in the lab and putting these together. We did many pitch competitions and went to investors and spent a lot of time developing pitch decks, lots of research done, keeping up on the statistics of seeing one child dying every week from pediatric heat stroke, doing, press interviews and traveling and presenting the product. And probably the hardest part is when you talk about this, it's not an easy conversation. We've received positive feedback, negative feedback. We've had people that have come forward to tell us of incidents where they have done this. They've never shared this before, that they had left their child in the car. And some people that really shamed us and said, you're making excuses for people and allowing this behavior to happen. And so really try to take the scientific point of view from this and look at failure of perspective memory and understand what's happening. When I explain to people, think about, have you ever driven home and thought, I don't even remember driving home? Or if you said, I'm going to stop on the way home and grab a gallon of milk, and then you get home and you forgot to do that. This is exactly how this is happening. And that's how I tried to explain it. And a lot of the cases when we looked at it, it was things like maybe there was a detour and they are used to taking their child to daycare before they go to work. And now there's a detour, so they had to take a different way. And so it's really what's going on in the brain, and it's overriding that. And those habits that you have kick in, and you just continue to do what you always know to do. So trying to get people to invest in it was a difficult process. And then we had been contacted by a very well-known large big box store that's known for baby products. And so they flew us out and we presented to them. In the first 5 minutes, they were sold. With the pandemic coming in, things were stalled. At this point, we are looking to license Backseet Buddy. I am Nurse Maria Striemer, the Senior Global Scientific Communications Manager at Procter & Gamble, the inventor and CEO of Backseat Buddy, the innovator of mask magnets that hold mask into place on your baseball cap or your scrub cap, and the innovator behind the Save the Ears campaign. When the pandemic hit, I knew from the time I'd worked in the OR, the strain that those masks have on your ears, and you start to have where there's skin breakdown and raw, and just from being maybe in a couple hours of surgery or working days having to wear that. And we'd never had a time where you always had to wear the mask. And now it was full-blown PPE and people were really struggling. And so I thought, we have a 3D printer at home. Why not print these ear guards, the one that people were wearing behind their necks, that their mask could fit onto to maybe take the strain off their ears. We started a campaign called Save the Ears, and we ended up printing thousands and thousands of these ear guards and sending them out to the frontline workers. From that, I developed these little magnets. They look like spools that thread would go on for baseball caps, and printed them and started a small business with that. We were just selling so many of these, and they would fit on caps and in the OR settings, and people could put their mask on those also to keep off their ears. And so that was something that came out when we pivoted for the pandemic. I have really ran the gamut with nursing. I've done a little bit of every type of nursing and all the fields, and you have to have such a great foundation of understanding. So we understand things from the ground up, building from the bottom up, working backwards from the what ifs. What if we did this? What solution would it create? Looking forward, what are you doing? What steps are you taking? What are we lacking? What do we need? And then to bring in innovation with startups and saying, what disruption and technologies are we seeing? What are new ways of keeping families safe, providing peace of mind? Find people that really want to make a difference and collaborate.
Nurse Maria Striemer is a serial innovator of health, safety, and consumer products, a sales executive and clinical liaison within the hospital and healthcare industry, the inventor and CEO of Backseat Buddy, and the innovator behind the Save the Ears campaign. You can find more information and links in our show notes at seeyounowpodcast.com. You've been listening to a snapshot of nurses as inventors on See You Now's Moment of Awareness. Email your moments of awareness, inventions, thoughts, and suggestions to hello@seeyounowpodcast.com. We can't wait to hear from you. I'm Shauna Butler. Thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.